Impact on the immune system. AIDS, or acquired immunodeficiency syndrome, is a chronic and potentially life-threatening condition caused by the human immunodeficiency virus, or HIV. This virus attacks the body's immune system, specifically the CD4 cells, which are white blood cells that play a crucial role in fighting off infections. As HIV weakens the immune system, individuals become more susceptible to a range of opportunistic infections, including those affecting the ears, nose, and throat. Rhinitis, commonly known as a stuffy nose, is an inflammation of the nasal mucous membranes. While often a minor annoyance for healthy individuals, rhinitis can be more frequent and severe in people with compromised immune systems, such as those with AIDS. This is because their bodies struggle to fight off the viruses and bacteria that cause inflammation. Similarly, ear infections, or otitis media, occur when fluid builds up behind the eardrum, often due to a bacterial or viral infection. In individuals with AIDS, the weakened immune response makes it challenging for the body to clear these infections, leading to persistent or recurring ear infections. The connection between AIDS, rhinitis, and ear infections highlights the importance of a robust immune system in maintaining overall health. The compromised immune system of an individual with AIDS creates an environment where opportunistic infections can thrive. These infections, while often manageable in healthy individuals, can pose serious health risks to those with AIDS. Diagnosing AIDS involves a multi-step process that begins with identifying the presence of HIV. The most common method is a blood test, specifically an antibody test, which detects the presence of antibodies produced by the body in response to HIV infection. If antibodies are detected, a confirmatory test such as a Western blot or an immunofluorescence assay is performed to confirm the diagnosis. Once HIV infection is established, determining the progression to AIDS involves assessing the individual's CD4 cell count. A CD4 cell count below 200 cells per cubic millimeter of blood is one of the criteria for an AIDS diagnosis. Additionally, the presence of certain opportunistic infections, such as recurrent pneumonia or certain types of cancer, can also indicate AIDS. Diagnosing rhinitis typically involves a physical examination of the nasal passages and a review of the patient's medical history. The doctor will check for signs of inflammation such as redness, swelling, and discharge. In some cases, allergy testing may be recommended to determine if allergies are contributing to the rhinitis. Ear infections are diagnosed through an otoscope, an instrument that allows the doctor to visualize the eardrum. Signs of infection include redness, bulging of the eardrum, and the presence of fluid behind the eardrum. In some cases, a sample of the fluid may be taken to determine the type of bacteria or virus causing the infection. The symptoms of AIDS can vary widely depending on the stage of the infection and the individual's overall health. In the early stages of HIV infection, many people experience flu-like symptoms, such as fever, fatigue, sore throat, and swollen lymph nodes. As the infection progresses and the immune system weakens, individuals may experience persistent fatigue, weight loss, skin rashes, and recurrent infections. Rhinitis, characterized by inflammation of the nasal passages, manifests as a stuffy or runny nose, sneezing, and nasal congestion. In individuals with AIDS, rhinitis may be more persistent and severe due to the weakened immune response. This can significantly impact their quality of life, affecting sleep, breathing, and overall comfort. Ear infections, often accompanied by pain, pressure, and a feeling of fullness in the ear, can also be more frequent and severe in individuals with AIDS. The weakened immune system struggles to fight off the infection, leading to prolonged symptoms and an increased risk of complications. These complications can include hearing loss, speech delays in children, and the spread of infection to surrounding tissues. Recognizing the symptoms of AIDS, rhinitis, and ear infections is crucial for seeking timely medical attention. Early diagnosis and treatment can significantly improve outcomes and prevent complications. Section 4. Treatment options. Managing AIDS and related infections. The primary treatment for HIV/AIDS is antiretroviral therapy, or ART, which is a combination of medications that work by suppressing the replication of the virus in the body. Now, RT cannot cure HIV, but it can significantly slow the progression of the disease, allowing individuals to live longer, healthier lives. Adherence to ART is crucial for its effectiveness in suppressing the virus and preventing the development of drug resistance. Rhinitis, while often a minor ailment, can be particularly bothersome for individuals with AIDS. Treatment typically involves over-the-counter decongestants and nasal corticosteroids to reduce inflammation and relieve congestion. Saline nasal sprays can also help to rinse the nasal passages and remove irritants. In some cases, antihistamines may be prescribed if allergies are contributing to the rhinitis. Ear infections, especially in the context of AIDS, require prompt medical attention. Antibiotics are the mainstay of treatment for bacterial ear infections, while antiviral medications may be used for viral infections. Pain relievers such as acetaminophen or ibuprofen can help to manage pain and reduce fever. In some cases, a procedure called a myringotomy, which involves making a small incision in the eardrum to drain fluid, may be necessary. Treating the underlying HIV infection with ART is paramount in managing AIDS-related infections. By strengthening the immune system, ART helps the body fight off infections more effectively and reduces the risk of complications. Section 5. Antiretroviral therapy, or ART, represents a significant advancement in the management of HIV/AIDS. ART consists of a combination of medications, each targeting a specific step in the HIV replication cycle. This multi-pronged approach effectively suppresses the virus, preventing it from multiplying and damaging the immune system. ARI has transformed HIV from a death sentence into a manageable chronic condition. The benefits of ART extend beyond viral suppression. By restoring immune function, ART reduces the risk of opportunistic infections, including those affecting the ears, nose, and throat. Individuals on ART experience fewer episodes of rhinitis, ear infections, and other infections that are common in people with weakened immune systems. This improved immune response contributes to a better quality of life and reduces the burden of illness. Despite its effectiveness, ART is not without its challenges. Adherence to the medication regimen is crucial for long-term success. Missing doses can lead to viral rebound and the development of drug resistance, making future treatment more difficult. Side effects from ART can also pose challenges, ranging from mild nausea to more serious complications. However, with proper monitoring and management, the benefits of ART far outweigh the risks. Section 6. Addressing rhinitis and ear infections in AIDS patients. Managing rhinitis and ear infections in individuals with AIDS requires a multifaceted approach that addresses both the underlying HIV infection and the specific symptoms. ART plays a crucial role in strengthening the immune system, making it easier for the body to fight off infections. In addition to ART, symptomatic relief is essential for improving quality of life. For rhinitis, saline nasal sprays, over-the-counter decongestants, and nasal corticosteroids can provide relief from congestion and inflammation. Antihistamines may be beneficial if allergies are contributing to the symptoms. It's important to consult with a healthcare professional before using any over-the-counter medications, especially for individuals with AIDS, as some medications may interact with ART or other medications. Ear infections, if left untreated, can lead to complications, especially in individuals with compromised immune systems. Antibiotics are the mainstay of treatment for bacterial ear infections. Pain relievers can help to manage pain and reduce fever. In some cases, a myringotomy, a procedure to drain fluid from the middle ear, may be necessary. Preventing ear infections is crucial, and strategies such as avoiding exposure to smoke, practicing good hand hygiene, and getting vaccinated against pneumococcus can help to reduce the risk. Addressing rhinitis and ear infections in AIDS patients requires a comprehensive approach that includes managing the underlying HIV infection, providing symptomatic relief, and implementing preventive measures. By addressing these aspects, healthcare providers can help individuals with AIDS live healthier and more comfortable lives. Section 7. Preventing HIV infection. Strategies for staying safe. Preventing HIV infection is paramount in the fight against AIDS. HIV is primarily transmitted through sexual contact, sharing needles, and from mother to child during pregnancy, childbirth, or breastfeeding. Understanding the modes of transmission and adopting preventive measures can significantly reduce the risk of infection. Practicing safe sex is crucial for preventing HIV transmission. Using condoms consistently and correctly during sexual activity provides a barrier against the exchange of bodily fluids, including those that carry HIV.